Hello, my name is Dr. Dave Webster, and this is part of my ongoing video blog series about the travesty of lack of access to PET-CT in our so-called evidence-based patients-first healthcare system. I had on my last video said I'm going to continue my series on the role of oncologists and cancer care in Ontario in our healthcare system, but I think it's important to go back and just focus for a minute about what this really is all about. And this really is all about the patients and what I see on a daily basis and the horrible impact, the travesty that happens to our patients on a daily basis across the province. This is a patient I saw last week, and this is a 42-year-old female victim of Cancer Care Ontario Mcmasters, and who have particular contempt for breast cancer patients. Now, this is a 42-year-old patient who was diagnosed with what we call locally advanced breast cancer in 2016. Now, what we mean by locally advanced is the primary tumor is greater than 5 centimeters and the regional lymph nodes are involved. Secondly, if it's directly invading the chest wall or skin, and also if, doesn't matter what the tumor size is, but if there are if there's involvement of the regional lymph nodes, then we consider it locally advanced cancer. And we differentiate that because these patients have more advanced disease and a more aggressive disease and a worse prognosis. And just to show you what I mean by regional lymph nodes, this is the breast here and the cancer. These are the axillary nodes here, regional nodes here, but these are the retrosternal or internal mammary nodes, and about the only way you can possibly pick these up, unless they're grossly enlarged, is with a PET scan. But of course, Ontario patients do not have access to this. So as part of her therapy back in 2016, she had some radiation therapy to her right breast and right axilla, which is fairly common practice for these patients. Now it's 2018, and she's got about an 8-month history of a bit of numbness and tingling, maybe a bit of weakness in her right arm. And what could the cause be? Well, in fact, the most common cause will be, remember, she had radiation therapy to her arm, and there is always going to be some scarring associated with that. So is that scarring going to pinch the nerve? And this is just a little diagram of the shoulder here, and this is the neck muscles here. And you can see these are the nerves, what we call the brachial plexus, and the blood vessels going down to the arm here. That's a pretty confined space. This is not her MR, but this now is the cervical spine and the lungs. And again, you can see the structures here. Now, this is the kind of radiation map. This is not the patient's pictures, but this is the kind of radiation map when they're doing radiation therapy that they would use to focus radiation in these areas. Now, another patient here, this is not again the patient, but again a similar situation, very common. Two patients who've had radiation there. The MR just reports a bit of thickening along the nerve sheath. But what is it? Well, this could be another cause, and of course there could be, and that would be recurrent cancer. Or is it scar tissue? Well, there's absolutely no way of knowing unless on the CT or MR, only way that we can tell with that is if it's very advanced and really far too late. But of course, if you live in Ontario, this simply isn't an option really at this point. Now, here's another case here. This is an MR. In this case, we're looking at hydrogen protons, and again, similar situation, symptoms, and again, the MR report is simply going to say, well, there's some thickening and duration, we're not sure, could be scarring, could be cancer. Well, this patient was able to go on and get a PET scan, and in fact, this patient has Hashimoto's disease, inflammatory disease in the thyroid, and again, this indicates this is not cancer. It just tells you we're looking at sugar, and when you have inflammation, it will show increased uptake of the sugar as well. This is the patient's normal bowel. So again, you must be careful how you interpret PET scans. Nevertheless, if we see this little spot here, that corresponds to this here, and in fact, this is recurrent cancer and not scarring, and of course, this patient will now need to go on for therapy. So here's another patient here, and now this is a CT, the lungs here, and again, you can see there is some thickening up here reported, and again, what's the CT report going to say? The only thing it can, because it's incapable of differentiating, it could say, well, there's some thickening, we're not sure, is it scar tissue or cancer? Obviously, major difference for the patient. This patient, not in Ontario, of course, gets a FDG PET scan, and you can see there's virtually, you can't really find any extra uptake there, and in fact, this is scarring, not cancer. This patient does not need further therapy. So let's look at a patient now who we know has disease here. They've had a PET scan, they've got the symptoms, and you can see this is the disease up here, and this is the pre-therapy scan, and this is the post-therapy scan. And when you look at it, there's essentially no excess sugar in that area, but But interestingly, the anatomical study of the MR still shows some abnormalities, demonstrating that the MR has no ability to determine whether it's looking at scar tissue or cancer. So this was an effective therapy. On the other hand, we have a much more aggressive disease process here, cancer in the left brachial plexus. But because the PET scan can look at the whole body, we can also see this patient has multiple lung metastasis of cancer. Again, a pre-therapy scan and the post-therapy scan. And although there's been a big change, there still is evidence of a little bit of active disease there, and also one here in the lung. Absolutely no way of knowing that without a PET CT scan. Too bad if this patient lives in Ontario, because we wouldn't even have known this. So this is what we call a partial response. Now, this is Mr. Doug Ford when he was running for a premier, to be premier, which he is now. And he talked about being for the people. This is Ms. Christine Elliott, and she's our Minister of Health. And her claim is that she makes the perfect Minister of Health because she was a patient in the system. We will be looking at what she did when she was Ontario's Ontario's first patient on Buds, to determine if that's really true or not. And this is Dr. Ruben Devlin, a political patronage appointment who's paid six figures to make sure that Ontario patients have access to quality care. They do not want breast cancer patients in Ontario to have access to PET CT. So, which people does Mr. Ford mean? Well, the people obviously does not mean Ontario's patients. These people are perfectly content with the status of Ontario patients reflected in the 2017 Auditor General Report, that it says, again, Ontario patients have the least number of PET scans per thousand population of any medical jurisdiction on the planet which offers PET. Okay, let's just take a minute to think about this. And if you're a patient watching this, or if you have a loved one has cancer, or you're just thinking about, down the road for you, this happening to you, think about what this means. Ontario has patients. We have the most restricted access to the world standard of imaging management among advanced medical jurisdictions anywhere on the planet. I mean, this was standard of care back in Chile 20 years ago. And everyone agrees that how we got there is not based on accepted methods of science, but based on a political agenda which is directed squarely at our patients. And top that off with cancer care in Ontario. Mcmaster medical experts are accused, and continue to do so, of performing unethical and bordering on immoral experiments on cancer patients. Is this really the kind of home you imagined Ontario to be? The only way this unconscionable, unethical, and immoral assault on Ontario patients will end, and they are actually allowed access to 2018 levels of medical care, is if we, the people, as it were, demand it'll have to be on social media, because of it. You don't need to be told that our most respected news agencies and journalists and news anchors, their job is to keep this from the public, but we need to demand on social media that the 2005 motions for an immediate, independent, unfettered review of the moral and ethical actions of cancer care Ontario and the colleagues at Mcmaster Health Sciences takes place. Now, in my next video, I'm going to continue on in my series about cancer care Ontario and their employees or oncologists, friends or foes of Ontario's patients, and I'm now going to summarize my 15 years of dealing with Ontario as an oncologist. This is my website and social media sites, and thanks for watching.